I am Executive Director of CEO Cancer Gold Standard, and in that role, I will work with all things Gold Standard, and particularly excited about the partnerships that we're launching with historically Black colleges and universities and Hispanic serving institutions to really help build sustaining partnerships that will be unique to each academic institution. Because it will certainly utilize the assets and the resources that they have and help expand some existing programs, or if we need to, build some new ones to really help enhance equitable health outcomes for all communities. So I'm thrilled to be here in that role. The theme, accelerating health, is very personal to me. As Bill said, I am a survivor. 14 years ago, last week, actually, I was diagnosed with stage 3C breast cancer. I celebrated 14 years last week, and every day I am grateful to see. Every day, it's not lost on me the importance of research, the critical component of access to care, and education, patient navigation. All of these aspects work together to help patients and their families navigate this journey. And when I was diagnosed, my daughter was 3 and my son had just turned 5. And I am grateful to say that I dropped him off a few months ago at Wake Forest, and my daughter is a senior applying to college. And I'm just excited to be able to see this chapter of their lives. I think that I'm often sitting in a theater watching the curtain open to different acts. And so I'm very grateful to be able to witness this act and this chapter. And it's not lost on me at all that research, data sharing, data collection, people that have enrolled in clinical trials to make the drugs available to me, to patients like me, to help me be here and to help sustain my life. So I'm really excited to be in this role and to help really improve health equity, and work with these institutions to bring the programs to campus and to help to support their work that they're already doing to help us all do better and to provide care for all communities. I think Bob Ingram used the word caretakers. We are caretakers of our health. I thought that was beautifully said, because if we can help empower ourselves to be our own best advocate in our healthcare, that's the best thing we can do. So I hope that we can do that through this program and other initiatives that we identify together with these universities. I am also thrilled to be able to introduce Dr. Julie Gerberding.
I thought I would spend a couple of minutes talking a little bit about why addressing health disparities are so urgent and why this is such an important opportunity for us to come together and really work collaboratively to do more than we've done in the past to address the underlying kind of core problem here. You don't have to read the statistics on basically any cancer to recognize that there are continuing racial disparities, breast, prostate, lung, just to name a few. We know that cancer diagnoses in African Americans and Hispanic Latino populations are often made too late, and people really don't get the advantage of early interventions, less complicated care, less expensive care, but also importantly, more opportunities for curative care or at least long-term palliative care. So, the reasons for this are complex, ranging from the social determinants of health through lack of access, and in some cases to lack of knowledge and best-in-class tools, much more science to be done and much more learning and clinical development in front of us. But I think the bottom line is we're failing to take advantage of the tools and the knowledge that we do have to really help everyone get the maximum value out of what we're doing today, to participate in the clinical development of the new tools that we hope to have tomorrow, and ultimately to be able to access and utilize those tools so that patients, caretakers, families, and our communities really finally achieve the optimal level of care that we can possibly create. So, I've been in public health for a long time. I worked at San Francisco General Hospital, which was kind of an exemplar of what happens when people are in situations where they can't avail themselves of community resources, or when they truly suffer from the social determinants of health and health disparities. I recognized this problem, probably for me personally, at the beginning of the HIV epidemic, but now that I'm at Merck and I'm well aware of our efforts in oncology, as well as many other areas of therapeutics, we can only do so much with medicines. And what we really need to do is to create the context where these medicines and vaccines can achieve their magic in the populations who need them the most. So that gives me a chance to talk a little bit of why I think the Going for Gold initiative is so critical. This is really a wonderful way to create exemplars that begin the process of addressing these health disparities in centers of excellence that are academically positioned, but also positioned in communities that have the most to benefit from their success. We know that our academic centers are beacons of knowledge, but they are also exemplars where people truly can walk their talk. So bringing the tenets of the CEO Cancer Gold Standard to these campuses in a visible way that allows the administration, the faculty, and the campus community to really, first of all, understand, to have the health education and awareness about what is really going on, not just about the disparities, but about the opportunities to really address these problems and become advocates for them. To really put a premium on every member of the campus community understanding the importance of prevention and early detection, to foster healthy lifestyles among the students and everyone else involved, but also making information about the importance of ongoing primary care screenings, vaccinations, and so forth so important. And then to assure that the benefits and the awareness of the benefits that covered people receive through the insurance programs that are present on these campuses are available to campus communities, that these coverage services actually include coverage for the quality treatment that's recommended, but also access to clinical trials and biomarkers, et cetera. And that in the event that we have a member of the campus community who is experiencing the need for cancer treatment or is in the process of cancer survivorship, that we have the inclusive environment that allows them to be accommodated, encouraged, and supported as they go through that journey, so that ultimately we are creating communities of well-being on our colleges. Now, we should be doing this at all universities and institutions of higher learning, but I think by positioning a special investment in the HBCUs and HSIs, we have a unique opportunity to set an example of what really is a potential force of true change at the community level. And if we're successful, we will not only have a healthier campus community, but we will establish the opportunity for that exemplar to become a beacon for the entire community, to engage students, their families who are not in the university, the alumni of the university. Many of the graduates of the university will they themselves be in positions of influence and thought leadership where they can kind of cascade this effort into their own networks and have that kind of influence continue to move as a true force of change. I realize that sounds a little bit grandiose and long-term and Pollyannic, but it starts somewhere. And I have learned through all of my years in public health that probably the most important factor that really does result in sustained health improvement is having a long-term strategy, investing in the communications, the support of thought leaders and communicators who are best positioned to have credibility and driving the change effort, and then sharing the learning as we go forward. So I think one of the reasons Merck is investing in this initiative is because we believe we can help be a catalyst to get this started. And we sure hope others will join us. But we also know that it's just the first step, and there are many, many more steps to come. We also hope that we would be able to serve as kind of a relay point. So as we learn things from our engagement, that we can help transfer and transmit those to our own employee base, but also to others who are in a similar situation of opportunity to make a true difference. We have a long journey to really address health disparities, but this is a very strategic investment that I think will create an opportunity to leverage much better health and much better cancer prevention and care for a population of people who truly deserves and needs to have access to that advantage. So let me just close by saying I really appreciate you giving me a few moments to speak today. You probably can sense my passion for this issue. I've been involved with the Roundtable one way or another for a number of years, going way back to the time when President Bush and Dianne Feinstein, Senator Feinstein, gathered us together at Kennebunkport and other environments to really think collectively, how could we work with employers and businesses to be cancer advocates. So it's really wonderful to have a chance to come back into this environment. Thank you for your leadership and for the important service that you really provide to the communities within your environments, but also the influence that you can exert as advocates, ambassadors beyond that. I think we can make a difference here, and together we will. Thank you.